In this lecture, we shall be looking at the digestive order. That is the disorderliness associated with the digestive system. When we talk about digestive disorder, it's condition that obstructs the normal function of the digestive system. That is the situation or the condition that prevents the digestive system from performing its function, from working normally the way it ought to be. That is the every condition that prevents or obstructs the normal functioning, that is the normal process of digestion in the digestive system. This disorder is also referred to as a gastrointestinal diseases. We call it GI or gastrointestinal dysfunctioning or digestive diseases. From the esophagus to the rectum, including the associated organs, that is the liver, the gallbladder, the pancreas, any disorderness or obstruction that is associated with the functioning of any organ of the digestive system in the process of digestion is referred to as a digestive disorder. We're going to look at different or few examples and look at where they occur or a few things that could cause them. The first one that I'm looking at here is constipation. Constipation actually is when you have hard, dry, or hard to pass stools. That is when the stool is difficult, when it is difficult for an individual to pass stool, or when the stool that is being passed is hard or dry. Most times you find individuals when they go to use the bathroom, it becomes difficult for them to pass stools. That is what we refer to as a constipation. And sometimes it could be infrequent bowel movement. That is a situation where someone goes to the bathroom to pass to maybe once in 2 or once in 3 days. So this is referred to as constipation, and it's usually caused by dehydration. That is when there's not enough water in the body, or maybe the person is not taking enough fiber because fiber helps in the process of digestion. Then it's also occur as a result of a lack of activity when someone is not active. So when the person eats, the food just sits down in the digestive system. So this and when you have a dietary change, that is when the diet of a particular person changes from the normal, so it could result into a disorder that is called constipation. Then we have the next one, irritable bowel syndrome, IBS. This is a long time when you have a long time functional disorder of the large intestine. So it affects the large intestine when there is a disorder which has been for a very long time. Most times, this type of disorder is when the large intestine cannot actually carry out the function that ought to perform in the process of digestion, which is absorption of water. So it can lead to gas, bloating, or abdominal pain. That is, the person begin to have gas inside inside the tummy. So it could also lead to the bloating of the abdomen, and as a result, leading to abdominal pain. We also have the next one that is referred to as acid influx or acid reflux, which is also referred to as gastro esophageal reflux disease, that is GERD, GERD. This one occurs when the stomach content goes back or come back into the esophagus. You know, between the esophagus and the stomach, there is one sphincter that is referred to as esophageal sphincter. So the function of that esophageal sphincter is when the food is moving down uh, the esophagus, the sphincter is expected to relax. And after it has relaxed, to allow the food to go into the stomach and it tightens up there. But if the esophageal, the sphincter, the esophageal sphincter, if it is weak, it becomes difficult for it to tighten up. So it is possible for the food that has been emptied into the stomach to go back. And this also happens when the sphincter relaxes. So when this happens, and it cannot change back, that is when the sphincter relaxes for the food to enter the stomach, but cannot change back to, to tighten up. So the tendency for the food to try to go back to the esophagus. Then when the another thing is that this type of disorder leads to heartburn or what we call regurgitation, chest pain. The person begins to feel pains on the chest and the feelings of lumps. I say, most times you have had people saying that it's like something is in their throat. When something like that happens or when an individual experiences something like that, difficulty in swallowing, the person is actually having a disorder that is referred to as gastroesophageal reflux disease or disease. Now, the next one is a Crohn's disease. This one is when you have inflammation of this small intestine, especially the ileum part. When we say inflammation, inflammation actually means cells trying to divide, unnecessarily. That is when they are not supposed to. You now have cells dividing uncontrollably. Let me put it like that. That is, the division cannot be controlled by anything and they continue to divide. That's what we refer to as inflammation. And when this one has been happening for a very long time, the symptom does not show immediately, but it's after a very long time that we have had inflammation in the small intestine, then the person is having a disorder that is referred to as Crohn's disease. The symptoms include the abdominal pain. The person begins to experience pains in the abdomen and also begin to experience cramps, fever, fatigue sometimes. Then the person begins to lose weight. So these are the symptoms of Crohn's disease. Then we have another one that is referred to as a gastritis. Gastritis is also an inflammation, but this time the inflammation occurs in the stomach, especially in the mucosal layer of the stomach. That is the layer, the wall that is lining the stomach. That is what we call the mucosal layer. And this is often caused by a particular type of bacteria that is referred to as H. pylori. So if this particular bacteria is present at that part of the stomach, it causes inflammation of this layer to take place. That is, this bacteria causes the cells of this particular part of the stomach, the walls of the stomach, the mucosal layer, for the cells begin to divide uncontrollably, and this can result into this type of disorder that is referred to as a gastritis. It leads to, burning stomach pain. The person begins to experience pains in the stomach. Sometimes the person begins to ferment, then experience nausea, then feelings of fullness. That's when you have an individual saying that I'm not even hungry. I don't feel hungry. So we have something like that occurring. Then there's another one that is called ulcerative colitis. This one is a long-lasting inflammation too, with a tiny open sores. Anytime you hear ulcer, the meaning of that is sore. That is, you have a sore. So this sore, when it occurs in the innermost lining of the colon, it occurs in the innermost lining of the colon and the rectum. So you have what we refer to as ulcerative colitis. Then there's also what we call a appendicitis. Appendicitis occurs where you have, I mentioned it the other time when I was showing you or teaching you about the parts of the uh, digestive system. So this one, I said the appendix is there, it leads nowhere. So if food, you know, try to move to that place, especially hard foods or hard materials. After some time, it swells up, it becomes inflamed. And when it becomes inflamed, the person begins to experience pains all over. And that pain, the only solution to that is surgery. The person will just undergo surgery and they cut the appendix off. Then there's another disorder that is referred to as a lactose intolerance. That is when an individual cannot secrete enough lactase enzyme. Lactase is responsible for the conversion of or the breaking down of lactose, like we look at in the case of enzyme. Now, this one, when someone is not able to produce enough lactase enzyme, the person will not be able to convert or to have enough digestion of lactose. That's why people that have such a disorder, they normally have what we call abdominal cramps, bloating, diarrhea after they consume anything that is dairy. That's where you see people that they say that, yeah, they're allergic to yogurt, they're allergic to things like that because they don't have enough uh, lactase enzyme that could act or that could digest the uh, the lactose in their food. So these are the enzymes, these are the different type of uh, ailments and the disorder you have in the digestive system. You have another one that is referred to as hemorrhoid. Hemorrhoid is commonly referred to as bile. When you have the swelling of the swollen, inflamed blood vessels in the lower part of the rectum and anus, the lower part of the rectum and the anus, when it swells up, that is what we call hemorrhoid. Sometimes in some people, it will swell up to the extent that it's going to show outside. And when it shows, it becomes difficult for such individual to be able to sit down. So this type of disorder is called hemorrhoid. Then we have gallstones. Gallstones occur when you have a deposit of bile after a very long time. You have the long-term deposit of bile in the, maybe in the bile duct or in the gallbladder, and you begin to have a sudden pain may result in the upper right of the belly. That is somewhere and end here of the belly for a long time. Bile is after the bile has accumulated for a very long time, it becomes solidified, then it becomes a stone. That is why it is referred to as a gallstone. Then you have the next one that is referred to as a pancreatitis. Pancreatitis, yeah. Pancreatitis is inflammation of the pancreas. There are uh, so many enzymes in the pancreatic juice that is being secreted by pancreas. And this is always or commonly caused by heavy alcohol usage. That is, when somebody has been using alcohol, has been taking alcohol for a very long time, the pancreas becomes damaged. And when the pancreas becomes damaged, in that case, it means that the pancreas may not be able to secrete enough juice that will contain the digestive enzymes that are necessary for the process of digestion in that particular individual. So in that case, you will have some foods that will be in the person's digestive system that may not digest or may partially digest. And this one leads to what we refer to as a abdominal pain. The person begins to feel pains, in the abdominal region. Sometimes the person can ferment, leads also to fever, and this type of disorder leads rapidly to what we call a heart rapid heart rate. That is, the heart continue to beat at a very, very high rate. So these are the few uh, digestive disorders that we're going to look at. Thank